Well, we can get some immediate reaction from the Nurses Union, the women that we've been talking about a little bit in that interview, the Royal College of Nursing, Pat Cullen, and the union says that its members will be walking out tomorrow and it wants direct pay negotiations with the government. Well, let's speak now, shall we, to the General Secretary and Chief Executive, Pat Cullen. Thank you very much for being with me today. We've just heard from Maria Caulfield, who says that the strikes aren't really about pay. They're only a small element about pay and it's more about conditions. Is that right?
No, that's absolutely not true. And I heard Maria describe in quite a disparaging way, pay has just been a tiny thing for our nursing staff. Our nursing staff are on the breadline. They're not able to afford their bills. Some of them aren't even able to afford travel to get to their work, for goodness sake. And yet we have a minister sitting here saying that it's about all of the other things and not about pay. That is absolutely not true. Of course, there are many other terms and conditions we would like this government to sort out for our nurses. Absolutely. But pay is fundamental if we are going to try and keep the nurses we've got in the health service and try and recruit more in. 50,000 vacancies in this country. And if we don't address pay, then I'm afraid most nurses would say to you tonight, they are fearful for where the health service will end up.
Right, let's talk about pay then, shall we? Let's talk about numbers. You opened negotiations asking for 19% pay rise, 5% above inflation. The government said that's unaffordable. What would you accept?
I said we'd get round a table and talk about this. But I heard you mention about the meeting that I had with Steve Barclay a few days back. And once again, brought into a room and told, you can talk about anything you wish to talk to me about, but we will not be talking about pay. And until I can get into a room and talk about pay to the ministers, then I'm afraid I'm not going to negotiate for the hundreds of thousands of nurses that will be on picket lines tomorrow over the airwaves. But they owe those nurses everything to get into a room and start to talk about pay. Surely to goodness, that's the only respectful thing they could do at this stage. Instead of what they're doing, they are allowing those hundreds of thousands of nurses to actually go onto picket lines tomorrow and stand out in the cold when they want to be inside looking after their patients.
But this is kind of the point, though, isn't it? Because you've said yourself that the Health Secretary isn't talking to you about numbers, and yet the government is making a huge play of the fact that you want a 19% pay rise. They clearly feel that that plays into their hands, that most people listening will think it's unaffordable. So surely this is your opportunity to give a bit of guidance on what you would accept. So in Scotland, for example, there's been an accepted offer of 7.5%. Would you accept that?
Look, we had an opportunity to stop the spin and start to speak a few days ago. I was very optimistic going to that meeting, hoping that at least we would have some sense shown, and then we could actually have stopped the strike tomorrow. But in fact, that was never going to be on the cards for this government. They brought us into a room, they marched us up to the top of the hill again, and they abandoned our nursing staff, the 320,000 nurses that have voted for strike action. That's an incredible and significant mandate, and you cannot ignore their voices. You absolutely cannot. They're not asking for, as I keep saying, their pockets to be lined with gold. They're wanting a decent wage. That isn't, they are entitled to a decent wage. And if we are going to try and address the issues within our health service, we need to retain our nurses that we've got in the health service, those nurses that Maria talked about today on your programme that are not able to get their annual leave. They're working every hour that's available to them to keep the health service going. And actually, when you talk about the 19%, we never asked for 19%. In February of this year, we submitted our evidence to the pay review body. And at that point, inflation was not sitting where it is now. And then in July, the government accepted the recommendation of the pay review body. I never accepted the recommendations, nor did our nurses. And inflation wasn't where it is now either. So the more they've dragged their heels and the longer they've dragged their heels, inflation has continued to rise, and consequently we're sitting at 19%. But what I would say to Maria and to Steve Barclay and any other minister listening, can you afford not to do this? And indeed, the International Council of Nurses wrote to Steve Barclay this evening and told him plainly and squarely that he cannot afford not to do it either.
So you're saying you never have asked for 19%. Just This is your chance, though, to clear it up. And I know, I understand what you're saying about, you don't want to negotiate on the airwaves, but I do feel as well that, nurses are going on strike. The public have a right to know exactly what it is you're striking for. I just don't understand why you won't be a bit more specific on what kind of pay rise you think would be, fair.
No, I'm definitely not going to negotiate on the airwaves. And I don't think that any minister should reduce our profession to have to do that. They should do the decent thing and get into a room and negotiate with me. I've also said if they find that maybe isn't suitable for them, that we will do it through conciliation and engage with ACAS. I don't think that's very much for our profession to ask. And I don't think that any minister should suggest or ask that we would negotiate on airwaves and not give us the respect and get into a room with us.
OK. If the government doesn't do what you're asking to, get around the table, negotiate on pay, should we expect to see more nurses' strikes?
Well, the ball's in their court, quite frankly. There will be a second day on the 20th of December. And unless we have talks and unless we are able to negotiate on behalf of my members, then I'm afraid to say that that's a very strong possibility. And already we will be starting to look at when those dates will be.
So what kind of timeframe will you be? You're saying you'll be looking at when that could be. What kind of timeframe are we looking at then, potentially?
I'm afraid that they will continue into January.
OK, that's really interesting to hear. Certainly something sobering as well if you look at the current waiting times for operations in the NHS. What do you think the impacts of the strikes will be?
Well, just when you mentioned waiting lists, I think that's a really important point. Why are those nurses going on picket lines tomorrow and losing a day's pay out of the meagre salaries that this government has insisted that they live on, that they can't live on actually? But our waiting lists are at 7.2 million people in this country waiting year on year on waiting lists, languishing on waiting lists. And why are they? Because we haven't got the nurses to be able to care and treat those patients. So the ministers will continue to talk about if we take money from the elective care waiting lists and give it to the nurses, then we won't be able to address the elective care waiting lists. But you'll address no waiting lists if you do not have the nursing staff to actually care and treat those patients. They're actually one of the same thing. So this is, again, all part of the spin that's put on this about taking from patients and giving to nurses. It's nurses that look after patients. And without nursing staff, patients in this country are getting a pretty raw deal, sitting on waiting list year after year, when their treatments should be given to them at a time when they require them, and then they can get on and live their fruitful and normal lives and continue to contribute to society. When in fact, because of the ill health and the increases in their ill health and their chronic conditions, they can't do that. So everything leads back to paying nurses a decent wage and ensuring we can recruit staff into the health service and retain those nurses we've got.
I was quite struck by some comments that you made after the meeting with Steve Barclay. You said that you thought the government was displaying particularly macho behaviour towards the Royal College of Nursing because it sees nursing as female work and doesn't value it properly. Do you think there is some sexism in the way that nurses are treated?
I absolutely do. And in fact, again, I refer back to the International Council for Nurses. And they have addressed that in the letter to Steve Barclay this evening as well. So it's a well-known fact that nursing staff is a 90% female profession. And if you think of some of the things that this government has done over this last number of weeks, I have to ask them, would they do that if those statistics were different, if we were not a 90% female profession? So just one example where they have decided that the military can come in and with a few hours of training, take on the role of a nurse, take on the role of caring for patients. And there's not a single nurse in this country would suggest that with a few hours training, that they could go out and put on a military uniform and take a gun and do what our military does, because they absolutely could not. But yet it seems to be that the value of caring is brought down to the lowest common denominator, and it can be done by anyone with a few hours training. And that's just so wrong. If you look at what the government has done with saying they're going to put in more draconian legislation to ensure that through their trade unions, nursing cannot have a voice, that's about trying to silence those nurses, the 90% female profession that we are. And I could go on. There's many more examples that I could use, but I'm not alone in thinking this. The International Council of Nurses believe it as well. And indeed, the people that I represent believe it.